Assalamu alaikum wa rahmatullahi wa barakatuh. I am Dr. Uwais, Essack, dentist at Aslan Dentistry, Northcliffe. We've decided to do a series on frequently asked questions, actionable tips, things that will help people just to get better care of their oral health and to avoid unnecessary pain and discomfort in the future. For me, from what we usually see with our patients and what we normally discuss, for me, diet would be the number one thing that people can look into, just to try and get some stability and to prevent cavities and pain in their mouth. When it comes to diet, what you eat is as important as when you eat it. So obviously we all know sugar is something that tends to cause cavities, carbohydrates in general. But when you eat as well is just as important. Your mouth is a very well-balanced environment, so it has you want it to be as neutral as possible. When you eat something, it becomes acidic. If you're constantly snacking throughout the day, your mouth tends to be acidic for longer periods of time, which then can lead to breakdown of your enamel, which causes cavities. So as far as possible, here's the actionable tip for you. If you are going to eat something and if you've had lunch, have your snacks, etc. as close to your food as possible. And after that, rinse out with some water. Water has a pH similar to neutral, close to neutral. So if you rinse out with water straight after eating, you immediately get that acid out of your mouth and get your mouth closer to neutral. Another actionable tip for people that they can start doing today is flossing. Unfortunately, most people don't do it. It's the lowest hanging fruit. It's a very easy thing once you get used to doing it. Your teeth have, an average tooth would have 6 surfaces on it, or 5 surfaces that you can reach to clean. So that would be the top and both the sides. But in between the teeth on either side is what is often missed when brushing, and that can only be reached with floss. So flossing would definitely be a major thing that you can change to try and get to try and reduce the possibility of getting cavities in between your teeth. That we can use as a segue into our next topic, which is bad breath. Most people, we get questions a lot, very often, about bad breath. The cause of it is very commonly a simple cause, which is food getting stuck in between teeth, which is not getting cleaned out by brushing. So that's where flossing comes into the picture. Brushing your tongue as well. Many people brush their teeth but forget to brush their tongue, and that can also be a cause of bad breath. There is also a possible chance that you have something called tonsil stones. So if your oral hygiene is at 100% and there's nothing that we can find that we can fault you on, we tend to then refer to an ENT just to get your tonsils checked. It's responsible for an average of about 30% of cases of halitosis or bad breath. So that's something you can look into. Mouthwashes. People always ask, should I use Listerine, should I use Corsidol, Endolex C? So when it comes to mouthwashes, it depends on what the problem is. If it's an acute problem, like you have inflammation, you have bleeding gums, you have infection in your mouth, the mouthwashes that you would use for that are not mouthwashes that you should use for daily maintenance. Those mouthwashes tend to discolor your teeth if used for over 2 weeks or more. They also should not be used very close to brushing because they get deactivated with ingredients from your toothpaste. The best mouthwash is obviously found in nature, salt water. If you want to use that consistently over a period of time, it doesn't cause drying of your mouth, it doesn't cause damage to your teeth, doesn't discolor your teeth, and it also reduces your chance of getting infections, bacterial infections in your gums and also in your throat. What toothpaste should I use? Toothpastes are the less important feature when it comes to brushing. The most important thing is to get the toothbrush to every single surface of every single tooth. So even if you don't have toothpaste, the toothbrush is doing majority of the work. So obviously for people who have specific problems like sensitive teeth, for example, you can get assessed by your dentist and then maybe start using some sensitive relief toothpaste. But in general, the toothpaste doesn't matter as much as having a toothbrush that is fairly new. The bristles are nice and straight, and they can reach every surface of every tooth. People also ask Miswak versus toothbrush. My answer is usually you should use a toothbrush, but you must use a Miswak. So if you're using your Miswak for during wudu, when you wake up, etc., there's very few people who can actually get a Miswak because of the way it's a straight stick. It's difficult to get it to every surface of every tooth, so that's where the toothbrush comes in. So use both. You don't have to, it doesn't have to be an either or type situation. Something that happens often that we see with patients with diabetes and gum disease have kind of like a stacking on effect. So if you have diabetes and you have, it leads to having gum disease that causes your gums to bleed more and causes more inflammation and causes more bacteria. If you have more inflammation, it makes your diabetes worse. So as a help to control your diabetes, it's always advisable for diabetics to have very, very strong control over the health of their gums. Lastly, I think it's very important for us to discuss childcare. It's a topic that's a bit closer to my heart because I have a 3-year-old son. We see children coming in very often with multiple teeth, with massive cavities, with infections in their mouth. It's very limited what we can do for them on the chair, especially because they're so scared and they've never seen us before. So the moment your child starts getting teeth, you need to start cleaning it with a bit of gauze or cotton wool. Later on, there's products that you can use, tiny toothbrushes, but let it be something that's non-negotiable. So although they might fight you to do the toothbrushing in the evenings and in the mornings, just make sure you stick with it until it becomes part of a daily routine. Just because it's milk teeth doesn't mean it won't cause pain, and some of the milk teeth are only lost at age 12 or 13. So that's a very long time, and if those teeth get decayed, it leads to a lot of pain, a lot of trauma for the children, and also leads to them needing braces later on in life. So the main thing that you just need to focus on is trying to prevent any cavities with your children. And please, I'm going to beg you to not scare your children with the dentist, because when they come in, they're already petrified, and it causes us to need to do a lot more. They spend a lot more time, and most of the time have to take them to theatre, which, as you know, is a very expensive process to do. So as always, prevention is better than cure.
Do not worry, your tears are heard by the